Hey guys, welcome to Solo ReacTalk. Today I'm going to be reacting to the healthcare crisis of 1941, World War II on the Homefront, made on the World War II YouTube channel. If you guys want to check out my previous reactions to the other episodes, remember the playlist card is going to be at the top here. Just click on it and be able to access them. If you want to check out the original video as well as World War II YouTube channel, links are going to be in the description below. Yes, okay, let's start. 3, 2, 1, go.
As soon as World War II breaks out, the nations at war face an acute healthcare crisis, not just to care for the wounded, but also to continue providing regular healthcare on the home front when the war overwhelms the already very basic healthcare systems. This is On the Homefront, a sub-series of World War II in real time. I'm Anna Deinhardt. When millions of men start firing guns and cannons, drop bombs on each other and civilians, and overrun territories forcing millions to flee head over heels, there will not only be a lot of dead people, there will be even more injured people requiring emergency care. Few healthcare systems in the world, both now and in the past, can handle war without being stretched beyond the limits. And it's not just injuries, but also an increase in diseases that comes with war. Now, imagine what that means. If you get sick, like Nancy, or hurt, also like Nancy, you likely have to take care of yourself, or your parents, your children, grandparents, a sibling, or a friend like me, without any medical knowledge, will have to take care of you. Home remedies are already the main way to treat emergencies anyway, but now...
And that is still also quite relevant even today. You know, home remedies, people use that more often than going to the hospital or going to the clinic, mainly because of hospital bills, you know, like life insurance coverage doesn't really cover everything, especially if you are an ill person. And yeah, you know, home remedies are still the number one, you know, thing that people do first before actually heading off to a hospital. Yeah.
Now you have to resort to these in a time of rationing and a general lack of supplies. Now, today I will focus mainly on the home front in Germany and the Commonwealth countries, who have been at war for 2 years now. I will cover other parts of the world in the future episodes. For these nations, well, for any nation, war means a greater need for medicine, medical equipment, doctors and nurses, both on the battlefield and on the home front. The need for new resources gets even higher when many people with a medical training also enlist and therefore leave their jobs. And 1941 is a time when healthcare is not a universal service anyway. In places where there even is healthcare, it is only the last 2 decades after the Great War that the creation of these healthcare systems have picked up speed. In fact, many people have little or no access to professional healthcare at all. For instance, in 1920s Italy, there's a complete lack of health insurances for poor people. It is Mussolini's regime that introduces the first system of compulsory and additional insurances in 1929 to moderate the social disparity.
Wow, that's quite a surprise. That is quite a surprise.
But they also used this progress to spread their ideology.
Oh. You got me in the first half. You got me in the first half.
Doctors who support the fascist government gain more influence and get more benefits during the redesign of the medical system. They use medical practice for political purposes by spreading ideas like that illness or health depends on the kind of people you are or interact with. Similarly, the government's fight against infectious diseases such as malaria, tuberculosis and syphilis shifts from battling the germs to targeting the carriers on ideological grounds. Nazi Germany too connects ideology with medicine. They even start to violently eliminate people with hereditary diseases by murder. Like in Italy, the racist Nazi mythology impacts healthcare negatively as the origin of disease and health are confused. But Germany also faces an increasing lack of medical professionals due to the very nature of their ideology.
And many of these doctors know what the problem is. They know after diagnosing the patient, like what's going on with this patient. But because of these ideological expectations, now the doctor must think, no, this person is cursed because of his or her particular race, or this person has gone mad because it's some sort of genetic curse that is associated with a particular grouping of people who believe in a religion or something, And the doctors know, they've studied this, they've understood what goes on in the human body. But because the politicians are telling them, no, this is what has led to this person's predicament, and therefore, they cannot be helped, they cannot be cured of their affliction, they need to be exterminated. It must be a very strange and just nerve-wracking situation that you're in, Your profession as a doctor is nothing compared to what the policy of the government says. You have studied for years, understanding the diseases, the DNA, the bodily functions, everything. And then you're to be told by a politician, no, this is not the answer, or this is not the reason why this person is ill. It's because of this. And you have to follow through with that. You have to make yourself believe in the policies that this government has just stated. Crazy.
Large parts of the population, like women, Jews, and political dissidents, are now forbidden from studying or even practicing most disciplines of medicine. Many doctors flee the country, and Germany's loss becomes the gain of others. Like in Australia, where there is a severe shortage of medical staff in the countryside.
And the issue is that Germany doesn't see it as a loss. They don't like the Jews. They don't like people who are, believing in that particular religion. They don't see them. They don't see them leaving as a loss. With that political, ideological nonsense that's flowing in their heads. They don't see this as a loss.
Now European refugees, among others, many German Jewish doctors give some hope. However, like in most parts of the British Commonwealth in the 1930s, you have to have British medical training to practice medicine in Australia, or go through a complete retraining. But in 1939, the New South Wales Medical Practitioners Act makes it possible for medical staff from non-Commonwealth countries to practice medicine in some regions. In Great Britain itself, the situation in 1939 is still quite similar to the one in Italy after World War I. If someone needs a doctor or any medical treatment, patients are generally expected to pay out of their own pocket. There is workers' health insurance, but that only provides for the workers themselves, not for the families. It leaves poorer people largely without healthcare, but there is change in the air. Already before the Great War, there is a vivid debate about how to improve British healthcare. As the 1920s progress, more and more people get access to hospitals run by local authorities and private interests, an approach originating with the Poor Law. By 1929, the Local Government Act empowers and instructs local authorities to set up services providing medical treatment for everyone. For instance, on April 1, 1930, the London County Council assumes responsibility for around 140 hospitals, medical schools and other institutions after the abolition of the Metropolitan Asylums Board. By the time the war breaks out, this is the largest public healthcare network in the world. But when Germany invades Poland, the progress takes another direction than public healthcare when the British nation focuses on emergency needs of war. To ensure the availability of medical aid, they cut up their cities into sectors. Dangerous areas get first aid stations and casualty sorting centers so that the seriously wounded can be transported to safer areas for long-term treatment. Remote sections are reserved for convalescents and the chronic patients. Already in September 1939, many London patients are evacuated to clear space for emergency cases. In Germany, preparations for war are running at full speed. But one thing the Nazis are not worried about is a lack of medicine. After all, even under the Nazis, Germany remains the world's biggest exporter for pharmaceuticals. With doctors and medical staff, it is a totally different story. Okay, so even after driving away many doctors, Germany still has one of the highest densities of physicians per capita, with 7 doctors for every 10,000 civilians.
But war can change everything. You think you're ready, you have the medical supplies, you have the medical staff. War can just flip it over and you'll have nothing left. You'll be on emergency rations and, scurrying across the entire country looking for medical practitioners. So yeah, wars can change everything.
But now, 1 in 3 medical staff is drafted to military service. To some degree, this is compensated by letting medical students in their last year take a doctor's place where there are shortages. That way, they managed to mobilize 2,400 stopgap physicians. Despite all the preparations, most countries are unprepared for the drain of doctors and medical supplies that the war immediately creates. In Canada, the shortage of doctors becomes a real problem, as many doctors, sometimes all the physicians of an entire town, enlist. The Canadian Medicine Association now launched an emergency research project of medical manpower and start working with the Department of Defense to solve the problem. Still, it will take until 1942 until the Canadian Medical Procurement and Assignment Board is founded, which takes it up to organize the supply of health resources. In Great Britain in 1940, the main problem becomes loss of hospital space due to the bombing by the Luftwaffe. In London, for example, the St. Thomas Hospital loses 508 out of 682 beds in an air raid. An eyewitness who lives through a direct hit of the Queen Mary's Hospital in London on the 7th of September 1940 describes the attack in the diary. In a moment, the bomb tore through the 3 floors and finally burst, leaving a huge crater, which was immediately filled by the large masses of masonry and steel girders twisted into all manners of fantastic shapes, broken equipment, and unfortunately the bodies of 6 patients and 2 of the nurses. In Germany, the military continues to drain the healthcare systems. In the first year of war alone, 20% of all beds of civilian hospitals are occupied by or reserved for the soldiers. Additional hospitals are established to make up for this, but they are poorly supplied and therefore are only able to take care of patients with minor sicknesses. Furthermore, the high hopes for an abundance of medicine now become a pipe dream. Many people working in the drug industry have to go to war, so production of the medicine drops significantly.
Now, I did not even think about this part, that the people who make the medicines are also drafting themselves, to go to head on out for war. So it's not only the medical practitioners, but it's also those who make the different types of medical equipment, those who make the different types of medical, medicines that are going to be used. They're all heading off for war as well. So this preparation that's been made by either Germany or any other nation is totally going to be thrown out the window. And they'll have to redraw everything, they'll have to reassess everything and try to make a semblance of a system that's going to work in or should I say during the World War II. Yeah. So really, when war starts, nothing is assured. You can say that you're prepared for anything, any type of enemy, any type of destruction, and you say that you're ready for it. But when that war begins and it continues to evolve and it continues to drag on from 1 year to 2 years to 3 years and on and on and on, all those preparations just go out the window.
Embargoes and blockades also force them to ration medicines that need ingredients imported from abroad like iodine and quinine. So unexpectedly, they now face a shortage, forcing the Nazi regime to scramble just to secure supply of the most important drugs, even for the war effort. Now, if you saw Indies in My episode about women's roles in the 1930s in our Between Two Wars series, you will know that to satisfy the war preparations, the Nazis have to dial back their measures to relegate women to the home already by 1938. In medicine, the attempts to ban women from academic professions has decreased the share of female doctors from double-digit percentages in the early 1930s to just 8%, who are allowed to continue working in limited medical fields like pediatrics or gynecology. But now, the Nazis dial back in this area too, and around 2,000 female doctors are reinstated and asked to fill in. Women are even allowed to once again study medical fields like surgery, from which they have been banned since 1934. But measures like that take time to have full effect, so even with emergency stopgaps, the number of doctors are only at 60% of pre-war numbers. If you are living outside of bigger towns, you might not even have a doctor to make the first diagnosis, but a nurse. That is, if you have the possibility to get to one at all. Fewer physicians mean longer journeys and even longer waiting times. As soon as you have succeeded in getting hold of a doctor, you might still only have up to 2 minutes with them, because there is an average of 100 patients' calls per doctor per day. To make things even worse, in 1941, a doctor gets only 2/3 of the already very tight general rations that they would have gotten in 1939. So now house visits get very, very difficult due to strict rationing of gasoline. And now, in the summer of 1941, after the invasion of the USSR, a deeper medical crisis emerges. The Nazis describe it with somewhat of an understatement, saying that the medical care and supplies will not be ideal everywhere. But this is a real turning point. Already from the first day, casualties on the Eastern Front are higher than expected. Medical supplies are being eaten up both on the front and as they get stuck in the endless supply lines leading into the deaths of the Soviet territory. By the end of the year, the struggle to secure enough hospital capacities for the civilian population will simply be lost, and there is a rapid decline of the medical provisions. A situation made even worse as the British will now bring the Blitz to Germany by bombing their cities. There, in Britain, the Blitz ended in May and the healthcare system has been given a chance to catch up. But the situation still remains grim, and just like in Germany, many people are dying for the lack of basic care. And as the war now rages to the east, it is the population behind the front lines in the Soviet Union that will face medical shortages. I will get back to that in future episodes, as I will try to cover healthcare in the home fronts in Eastern Asia. In any case, it's a lot of suffering and one can easily lose faith in humanity. But in that moment, we should remember one thing. After this war is over, the crisis facing healthcare in many parts of the world in 1941 will be one of the main things that creates a rapid rethinking of public healthcare, especially here in Europe. In Great Britain, it will give birth to the NHS. In Germany and many other parts in Europe, the tragedy of the war will contribute to the reforms that will eventually lead to the universal health insurance and healthcare systems with capacity for many, many more people than before the war. So if now, in 2020, you feel a scratchy cough coming on, or one of your loved ones has come down with COVID-19, remember that it was the sacrifice of this generation that ensures that you have a much better chance of getting well again. Now, it's the contributions of the Time Ghost Army that makes sure that our channels stay healthy and alive. Sign up for the Time Ghost Army on Patreon or timeghost.tv. Make sure to subscribe and ring that bell. Stay safe and take care of your health and that of others.
Okay guys, that is it with the healthcare crisis of 1941, World War II on the Homefront, made on the World War II YouTube channel. Yeah, you know, just like with food, these are things that people assume governments are ready for. You know, like they've stocked up with the food rations, they've stocked up with the medical equipment and rations and medicines and all other forms of things that are required, and they believe that they are prepared and ready for any type of situation during the war. And it just doesn't happen that way, you know. Things happen, all of a sudden you have to send at least 80% of all of your medical equipment and medicines off to the front lines because you're losing a lot of men, or you know, a lot of your men are injured, and they need those resources so that they can continue the fight. And then all of a sudden you can't produce any more to replace what you've sent out, because the people who produce these equipment and medicines are also on the front line. And just like with the doctors and nurses, you know, you prepare for this war thinking that you will have enough and sufficient numbers to continue your medical health system. But then you're surprised by how many doctors have now also signed up to enter into war. And you know, those who are left behind, it's just not enough to cover not only for the civilians but also for soldiers who are returning from the front lines. And it just becomes a chaotic situation, a catastrophe, a humanitarian catastrophe. You know, the country's population is now not only starving because there's no food to go around, but also there is no medical services that are close enough to them. And even if they are in the cities, they'll be waiting in extremely long lines, and there's bombing raids, and you know, there's other forms of situations that are occurring, which will ultimately lead to the patients probably losing their lives before they even get the chance to be seen by a doctor or by a nurse. So yeah. But what Anna did say about, you know, after World War II, what was created from that, you know, in terms of medical health insurance and full coverage of an entire country with medical services. Yes, that is a good thing that has come out of World War II. However, we still have issues even with that. Well, I don't know about Europe in particular, but you know, maybe in Africa and South Africa particularly, and in other countries where yes, there is a coverage of health services, but it doesn't cover as much as it should. You know, it's still in the hands of those who have money that will have the best medical care, and those who don't have money, you know, they will have the basic medical care, but not enough to, you know, save their lives should they have some sort of like chronic illness, or you know, they need a surgery that would cost in the hundreds of thousands of whatever currency they use. So yes, basic coverage is a good thing, very, very good thing that it's there, but we also need to find a way to increase that coverage to the point where, you know, should anything happen to you, you know, bodily function wise, or in your bloodstream or whatever, and you need that medical assistance, there should be no barrier, there should be no hindrance from you getting that medical service. I think that is still something that we still need to try and figure out and make it more affordable and available to everybody. Yeah, I don't know about Europe, but I know in Africa it is still a serious situation in terms of health access, and also particularly in my country, in South Africa, we do have the public and private health systems, but you know, the disparity between these two, the public and the private, is very, very large, very, very large. You know, those who can afford, they get the best treatment. Those who can't, they go to the public, and public, it's not enough. You know, needs more support, needs more finance, it needs more doctors and nurses to be working in that field, in the public sector. You know, so yeah, there's still a lot of work to do, but after World War II, it was a good start. I will also admit to that. Yeah. Okay, guys, I guess that's it. That's it for today. Remember, if you want to check out the original video as well as World War II YouTube channel, the links are going to be in the description below. If you like my reaction, please give me a like, comment, and subscribe to my channel. Click on the notification bell if you want to be up to date with my latest videos, and I'll see you guys next week. Okay.